Hello, I'm Manoj Karmakar, your host and the convener of the ISSPS. I'd like to welcome you to the ISSPS 2021 webinar series. Today is the second of 10 webinars. If you're returning, welcome back. If it's your first time, then a warm welcome to you. I bring you greetings from this beautiful city of Hong Kong. Hopefully one day, not in the near future, you'll be able to visit us and our beautiful city. We are coming to you live from our studios at the Prince of Wales Hospital. We are part of the Chinese University, which is not far from the facility that we work at. This event is being organized by the Department of Anaesthesia and Intensive Care, the Faculty of Medicine of the Chinese University, and is being organized as part of the 40th celebration of our university. This event is being supported by Sonic, a new and vibrant company that's developing some wonderful ultrasound machines not far from Hong Kong in the city of Shenzhen. If you are interested in previewing some of these equipment that they are producing, then do feel free to contact your nearest representative in your city or nearby, and I'm sure they'll be more than happy to loan you a system that you can use. And today we'll be using their system in the live demonstration. I'm proud to announce that we have a total of about 2,800 participants who are registered for this event to date. And this is the layout of the number of participants from different continents. We have participants from Australia, New Zealand, all the way to South America, from Peru, Bolivia, and Chile, etc. So a warm welcome to you all. This is a layout of number of participants from different continents and countries. The largest number of contingents are from India. Second is China, and we have many participants from Indonesia and Thailand. Anyway, so today I'm being joined by two good friends, two great teachers, to share with you our passion and knowledge about paravertebral and epidurals in the thoracic region. This will be initially started with some didactic lectures, and then later on we will have a live demonstration followed by a Q&A. The first, a good friend, Professor Bernhard Morgel, he comes all the way from Innsbruck in Austria. He needs no introduction to those that have already attended his lectures in the past. He's a doyen in anatomy. He's as big can get. He's also been using ultrasound for anatomy since the early 1980s. So many of us, including myself and many of our peers in the field of regional anesthesia and pain medicine, have actually been his mentees, and he has mentored many of us to learn the art of anatomy and ultrasound imaging to view many of the sono-anatomical structures that it is very commonly understood today. He's very well published. I need not say he is extensively quoted in many publications. His work has led him to lecture at many conferences around the world. On a side note, he's also a big Rolling Stones fan, and many of the time he jams with the band and sings some beautiful Rolling Stones numbers. Hopefully someday when we are together, we would do that in our venue. The second speaker today is another good friend of mine, Kenneth Xia. He comes all the way from Singapore. He's not an anesthesiologist. He's a radiologist par excellence. He's a great teacher. He's very well known in the field of radiology. He's published extensively and teaches in many radiological conferences. Today, he will share with us his experiences and his know-how of how to use ultrasound and the anatomy pertaining to the thoracic region, which is pertaining to epidurals and paravertebral injections, given that he has an extensive experience and knowledge in the field of pain medicine. Just a few housekeeping matters. Since this is a webinar, the attendees have limited privileges. So you will be able to interact with us via the chat functions. So if you have any questions that you would like to pose to the speakers relating to any of these talks today, then um, please express them in the Q&A, and do mention your name and where you come from, and one of our moderators will pick these questions up, and then we will discuss this at the panel discussion and the Q&A at the end of the webinar. So since you are from different areas, do remember to mention your name and your location from where you are coming from. Just a few other notes is that these are some of the books that come out from this university, from this institution. So if any of you are interested in acquiring this blue book, then do get in touch with us, and we will guide you as to how you can get this book for your practice. So once again, a warm welcome to you all. And without further ado, I would now like to welcome Professor Bernard Morigal, to share with us his knowledge and experience on the functional anatomy relevant for thoracic, epidural, and paravertebral injections. Welcome, Bernard.